Acute respiratory infections, infections of the lungs, caused by a broad group of organisms, but all attacking the same organ and causing illness in the same way, are the third leading cause of death in the world each year for adults and children. But in children particularly, children under 5, this is the group of illnesses that are the leading cause of death, and as many as 2 million children each year die in the world from acute respiratory infections, and many of these deaths are preventable and treatable.
There has been an up and down trend for acute respiratory infection since its inclusion in the morbidity statistics in 2008. Prior to its inclusion, acute lower respiratory tract infection and pneumonia were the #1 cause of morbidity from 1997 to 2007. Starting from 1996, pneumonia was constantly third in the leading causes of morbidity. The morbidity trend decreased slightly from 1997 to 2000, but the number of cases remained high at 829 cases per 100,000 population in 2000. On the other hand, there is a decreasing trend of mortality from pneumonia in the general population from 1990 to 2000, despite the high number of cases per year. Current evidence suggests that the major mode of transmission of acute respiratory infections is through large droplets, but transmission through contact, including hand contamination with subsequent self-inoculation, and infectious respiratory aerosols of various sizes and at short range, coined as opportunistic airborne transmission, may also occur for some pathogens. Opportunistic airborne transmission may occur when conducting high-risk aerosol-generating procedures, and airborne precautions will be required in this setting. The etiologic agents for acute respiratory infection may be viruses or bacteria. Bacterial agents include Bordetella pertussis, Corynebacterium diphtheriae, Haemophilus influenzae, Klebsiella pneumoniae, Legionella pneumophila, Staphylococcus pyogenes, Streptococcus pneumoniae, and Streptococcus pyogenes. Among the viruses include enterovirus, influenza A, B, and C, measles, parainfluenza 1, 2, and 3, respiratory syncytial virus, rhinovirus, and coronavirus. Interventions to control acute respiratory infections can be divided into 4 basic categories. 1. Immunization against specific pathogens. 2. Early diagnosis and treatment of disease. 3. Improvements in nutrition. 4. Safer environments.
Pneumonia is an acute infection of the lungs. Pneumonia is particularly dangerous for babies, young children, and the elderly. It may follow diseases such as measles and flu, and it can also be associated with HIV. A child who is coughing or has difficulty breathing may have pneumonia. So how do you assess the coughing child or child with breathing difficulties? Even if the child's mother says the child has no symptoms, you must check the child. Firstly, observe for fast breathing. count the breaths in 1 minute. In children aged 2 months to 12 months, the child has fast breathing if it's 50 breaths or more per minute. In children aged 12 months to 5 years, it is considered fast if it is 40 breaths or more per minute. Look for chest indrawing. In a child aged 2 months up to 5 years, if chest indrawing is clearly visible and present at the time during an examination, it is a sign of severe pneumonia or very severe illness. With chest indrawing, the lower ribs on both sides of the chest are pulled in when the child breathes in. This is very abnormal, as the lower chest normally moves out when a child breathes in. When resting, children should never have chest indrawing. Listen for stridor. Stridor occurs when there is a swelling of the upper part of the child's throat. A child who has stridor when calm has a dangerous condition. Listen for stridor when the child breathes in. Put your ear near the child's mouth because stridor can be difficult to hear. There may also be associated fever with the above symptoms and general danger signs, such as an inability or refusal to eat or feed, vomiting, seizure, and unconsciousness. Antibiotic treatment can only be initiated if the community health worker has a drug pack available. If the child has general danger signs, chest indrawing or stridor when calm, give the child their first dose of antibiotics and refer to hospital immediately. If the child only has fast breathing, you can start the course of antibiotics provided in your pack without referral and follow up in 2 days. If you have no packs, refer to hospital or local medical officer. If the child has none of the signs mentioned, this is not pneumonia and can be treated with a home remedy such as a syrup made from 1 part honey, 1 part lemon juice. The community health worker must check the child again in 5 days.